malaria medicine donated by the USG found itself in a private pharmacy. He was asked for evidence, and he provided the evidence to then Permanent Secretary Malama. The person involved, the pharmacy involved, I think ended up paying 24,000 to ZAMRA. When I was at ZAMSA, about April, May, ZAMSA sits on the anti-theft committee as a permanent member. So I, together with the DEC Director General and the PS Technical Services, Dr. Lishimpi, participated in a crackdown of pharmacies to check which ones may have been guilty of this scourge. For me, I went further, and I was engaging with some doctors like Dr. Jimuka, young Dr. Jimuka at UTH, and basically they came up with a proposal which I took to the national coordinator at the Smart Zambia. And what's the proposal? The proposal was to help digitize the whole issue of medicine prescription. Because you see, Hope, when ZAMSA's job is to buy, store, and distribute. But once we have distributed, we have no control. The control then is taken over by the public health facilities under the supervision of the Ministry of Health. So, if there is no visibility of how the Panadol moves from Pharmanova to you, Hope, as a patient, it means that it's very difficult to know at which point the leakages are happening.
I was actually going to ask that, but we seem to have we, or maybe let me rephrase it. Have we identified where the problem is if we are going to come up with a solution to this? Because we all want to know where the leak is. Where is this problem coming from? We heard what the minister has to say and the arrests that have been made so far linking to the Ministry of Health, where we're pointing at the pharmacies as well. But haven't we understood this system very well if we're going to come up with a solution to this problem?
I don't think it's a question of not understanding where the leakages are. One of the things that is simply there is that there is just not enough money to actually make sure that we digitize all the 3,500 plus public health facilities. Each of them, you know, we are living in an information technology era. So there is technology that enables you to monitor effectively from the time you buy from the manufacturer, okay, or the retailer. You can follow the medicine up to the time when it's being disbursed at the public health facility. And Hope, this is...
So it's because there's been no money. Is it because the money has not been there, or it is the will to get it done?
The money has not been there. And you remember last time I was saying that for the first time when I moved into ZAMSA, the Treasury understood that it was necessary for ZAMSA to have adequate money for procurement, storage, and administration. So, Hope, in the administration, that's where you would have systems that can help you to digitize the whole thing so that you have visibility of the medicines from where they are distributed from ZAMSA into the... So it's just surprising that you can have $200 million of Zambian money. It is there for medicines. And you can't give 10%, so that 10% helps in security, CCTV, systems that can enable ZAMSA and Ministry of Health to work smartly. As we talk, Ministry of Health has always had what they call the control tower. In the control tower, they see what, first of all, they sit every year to plan for 3 years. So they know what is coming and what is being distributed and being given to the public health facilities. So that process is largely, it's semi-automated. But what is required is to have it completely digitized because the technology exists. So as I have said before, it's in public domain. There just needs to be seriousness. That if you can put $200 million for medicines and medical supplies, you shouldn't have CASO to find money to secure it. That is.
What do you make of the recommendations that were given by the U.S. ambassador regarding the theft of drugs in these institutions? I mean, he gave quite a number of recommendations there. You obviously followed up on what he had to say. I mean, you were in this institution. Do you agree with some of the suggestions he gave?
I do agree in full. But let me just finish the reason I am here. Let me just say that in summary, that portion of the minister's statement to say that, one, I am fired and arrested for medicine theft is not true. Two, that I am in court, it is not true. The truth is that I was fired by a kangaroo court, and at the moment, the matter is yet to go to court. So I'm going to court to answer on procurement irregularities that the state has leveled against me. I am not going to court in order for me to answer on something I have no idea about.
And you have given him 72 hours to retract that statement?
Yes, I do hope that he will be magnanimous and come back. And if he doesn't, we'll have no choice but to proceed the whole works.
All right, and then there's the question I asked right now regarding the recommendations that were made by the U.S. ambassador.
Yeah, so one of the things that we are very good as Zambians is writing papers and analyzing issues. And there's nothing new that the ambassador is saying. What is required, you see, the frustration of the ambassador is that after 33 meetings and many conversations, not much has happened. And so I do agree with him in terms of recommendations. If there can just be, I think you're right when you say political will, because the political will drive the availability of money so that you put your money where your mouth is.
Mm.
Yes.
Were you aware of theft or diversion of medical supplies during your tenure? And if so, what actions did you take?
So I was aware, and I was first made aware of this problem by my predecessor, Mr. Billy Mwetwa. And the nation needs to know that the job of ZAMSA is to buy, store. So once we have distributed, that's it. There are other arms of government that take care of that aspect.
Yeah. Or maybe just kindly explain the process so that Zambians can get that picture right now.
So what happens is that ZAMSA buys medicines. Once they buy medicine, it comes into the store. And once it is in the store, there is some system that is used by public health facilities to put in requests for medicines. And we take those requests and schedule them according to where the medicines are supposed to be going. And then from there, we distribute. Now, the USG medicine and the medicine that comes from Global Fund. For Global Fund, if they give you 80 million, they'll give you 8% so that you can have money to store and also distribute. The US government gives the medicine, and then they just contribute towards the distribution. Okay, so they have a system whereby they call it third-party logistics, Once the schedule is ready from ZAMSA, they provide the transport, which they hire themselves as a way of contributing to helping us distribute. And then it goes. So once it is at the public health facility, it is in the hands of the chief medical officer and his staff at that level. So there's where we start and finish as ZAMSA. There's where other parts of government take it up. That is, in brief, what it is.
And for those that are pointing fingers at ZAMSA right now, what do you have to say? Because, or rather, do you think the drug theft issues stemmed from weaknesses within ZAMSA? Should any finger be pointed at ZAMSA right now? In as much as you've explained what the process is like, should any finger be pointed at ZAMSA right now?
All the reported pilferage that happened while I was there, it was a very short time, were things that were happening outside of ZAMSA. Because to be fair, with very limited resources and very difficult space, ZAMSA tries very hard while the medicines are within their charge. So it is between ZAMSA and the public health facility, that's where problems begin. So you will remember, Hope, that the ambassador is saying this is a long-standing problem. There is a suspicion of organized crime. So because it is organized crime, it requires a deep organized approach to the issue. And it does mean that there needs to be resources also attached so that the security of the medicines, as they are being moved from ZAMSA to the public health facility, is well taken care of, because the technology actually exists. So ZAMSA is an integral part, but you will note that the people who are supposed to check that private pharmacies, for example, are selling their own medicine not stolen from ZAMSA are actually ZAMRA. So it is the duty of ZAMRA to do inspections, to move in using intelligence, and so on and so forth. Because ZAMSA's job, although they are a critical element, does not extend to the security of the medicine while it is in the public health facilities.
And what do you make of government's reaction after the statement by the U.S. ambassador? I mean, we saw the police swing into action as well. Some arrests have been made. So far, we were notified that some arrests of health officials, as well as, some pharmacies, the police, got there, and some have been arrested. What's your reaction with this move so far?
So, actually, the true position is that some of those arrests have happened over a period of time, way before this position was brought to the public. And I just told you that I participated in a crackdown where some pharmacies were found wanting. And so those arrests are related to that work. So the action, I think the nation must not miss the point here. The issue is that this problem has been known. The US government has gone in and investigated and come up with a report, and they came up with a report 2021. This report was presented to government. So the frustration which is there, the accusation which is there from the ambassador, you saw him shed a tear, was the inaction, or more accurately, the snail's pace at which this action is being taken.
Do you agree with him because he touched heavily on that, saying, I've had several meetings with quite a number of permanent secretaries. We've touched on this issue several times, and there seems to be no action from government. This is taxpayers' money, American taxpayers' money, and we know the story with America right now. It's America first. So when he brings out all these issues saying there's been laxity on our part, do you agree with him?
It's a no-brainer. that he said himself, it's a fair comment because it's in public domain, that he is so frustrated that after so many meetings with so many high-level officials who expressed each time they were meeting, those 33 times, they expressed disappointment. Nothing tangible has happened.
Would you have agreed with him if you were still at the helm of ZAMSA?
Of course. I mean, I agreed. I did attend 1 or 2 meetings of the meetings to do with anti-theft, and I've just told you I participated. So I do agree that look, it's not my it's not me who took out the frustration. It is the ambassador. He's saying he's frustrated at the snail's pace at which government is moving. And so my coming here is the pain of government trying to say, oh, we've done something. What have you done? We've fired Victor. Now, you know, I mean, by doing that, that is deflection of what is there. He was not asking about a procurement done by Zambian money, done for Zambian suppliers of pharmaceuticals. No, he is interested in his money from his fellow taxpayers in the US, and he's saying, guys, you've got a problem. We're giving you free stuff. It is being stolen. Can you do something? Well, that's what he is saying. Now, instead of the answer just being, okay, we've actually done something. But even if you say that, then he says, but that's just small fish. You have to go after the masterminds. So, and the masterminds are not, I'm not one of them.
I was about to ask you if you're one of the, when he says they're bigger culprits, do you feel one of those fingers is being pointed at you, Mr. Nyasulu?
That is what Honorable Muchima wants to believe. And I'm sad to say that is what perhaps most government. I've heard it by my own ears.
So you feel you've been made a scapegoat for larger issues within ZAMSA?
And I'm being made a scapegoat for what I don't know. In 2021, I was not anywhere near ZAMSA. I didn't go to ZAMSA until 2023 April. I was headhunted to go to ZAMSA. So I that malaria medicine donated by the USG found itself in a private pharmacy. He was asked for